Well, thank you very much. And I want to also thank the city of Thousand Oaks for being so patient. I know you guys have a lot of great programs you want to share, and unfortunately, T comes at the end of the alphabet. So I promise next time we do this, we'll flip the script and let you guys go
Well,
first.
I actually wrote John's presentation, so and I think we're done. Everything was already said. I do want to answer a couple of your questions before we start. One on the reality party, you heard that discussed a few different times, and just to let you know, it's done through behavioral health, and it's done in the city of Thousand Oaks and in the city of Simi, of course. And they have kids as the actors, and they go through different rooms, and they depict what happens, and it's education for parents, what happens at these parties on a Friday and Saturday night. You'll hear the term, a kid will say, well, yeah, I'm going to a farm party. And a lot of parents don't know what that is. So in this reality party, they'll have alcohol there, empty bottles, of course, and they'll have just a bowl, a Skittle party, but it's all pharmaceuticals. All the kids come to the party and they take pharmaceuticals from home. And they all throw it in there, and they combine that with alcohol. From that, the dangers of having home parties and what happens, the sexual assaults and other violent crimes that occur either that night or the next day. We educate people who have the attitude, parents who have the attitude, my kids will drink anyway, so I'm going to provide them a place to do that. And what the dangers are of what happens at these home parties, but it's taught by kids to adults. So it's very impactful. It's been very successful in Simi and in Thousand Oaks. On the other part, you had asked about how are we working with the youth on a prevention model. And Jim and Eric are going to go into that, most of our prevention efforts. But we just started this year. We found that we went away from DARE, Ventura County Sheriff's Department did. We found it to be a very successful program probably in the 70s and 80s. Well, as all of us know, technology has changed all of us, how we communicate, what kids have access to. And so we transitioned to the SRO, but we felt that we left behind the 4th, 5th, and 6th graders, the middle schoolers. So what are we going to do with them? And the Thousand Oaks Police Foundation funds a program contracted with a company called Fulcrum. The name of this program is Stand Proud. And we wanted something that was measurable. There's a lot of great programs out there that they're kind of one and done. And what's going to happen, what's this 5th grader going to do in the 7th grade and the 9th grade as they get older? So the premise of this is really choices. It's not only substance abuse and the self-esteem thing, it's all about the choices they're going to make and the consequences with those choices. So they get that in the 5th grade. The company comes to the school. Every single 5th grader went through this in the Canyon Valley Unified. And then they do rope courses and some other things for a couple days at a camp in Malibu. Now we'll do the same thing in the 7th grade and the same thing in the 9th grade. The school district will track expulsions, any kind of discipline within the school district. And we partner with them. We will track arrests, substance abuse, are the arrests going down? Use of alcohol, marijuana, are they going down as the kids get older? We wanted something that was measurable. So I wanted to just give you some additional information on that before we start. Okay. Overall, in law enforcement, when we have a problem, when we work with the community and we put some law enforcement resources on that problem, oftentimes we can solve it. This is a situation that we can't arrest our way out of. And we saw the same spike as everyone else did, 2010, but last year, 2012, we had 30 overdoses and 4 deaths. And I don't speak for other agencies very often, but I'll speak for every officer in this room. The worst thing that any one of us have ever had to do in police work is knock on someone's door and tell them they've lost a loved one, especially when it's an overdose and it's a teenager. There's nothing more heartbreaking. So what are we going to do about it? John had mentioned the task force. It's a pharmaceutical task force. We've just started it. It's with the Ventura County Sheriff's Department, City of Thousand Oaks police officer. We contract with the sheriff, Simi Valley Police Department, district attorney investigator. But just as important as this enforcement is having the medical board with us as part of this task force, the state insurance board, They don't physically go with us to do investigations, but we are going after these rogue criminal doctors in our community where we have a teenager go to a doctor with a back problem and he prescribes 75 Oxycontins. We now have a heroin addict in our community because of this. The rogue pharmacists, we've made 3 arrests and we've got several doctors that we are targeting for this kind of behavior. When we have someone involved in a traffic accident and they have 18 pain medications prescribed by one doctor. Those are just examples that we're seeing in Thousand Oaks and why this part is so critical. This part of the enforcement is so critical. This will have an impact. The other part of it is we have a street narcotics team. John and others had mentioned, and when we talk about technology, what our kids have access to. We have the delivery services. And we also know that there's not large block walls in between LA County, Ventura County, and the cities within both counties. So we have to work together. So we work these delivery services, but kids that are ordering and dope dealers that are on Craigslist and selling to our youth. And the education portion of that to the parents, especially in affluent communities where many young people have a credit card from their parents. And I often ask parents if they ever check the credit card, and they don't. And these kids are purchasing things online, and a lot of things that come from India, from China, and it's not what they expect, and it's cut with whatever, and we have an addiction problem. It feeds into it. So we look at that, and with this task force to target these criminal doctors and pharmacists, people with a medical license that shouldn't have that, that's part of the problem. The other part in our street task force, John had mentioned, you don't have somebody, and this is 100% true, you don't have somebody, a high school kid, wake up and they're a heroin addict. We need to back this up and look at the big picture of substance abuse in our communities. When you look at alcohol, when you look at marijuana, now marijuana has changed. And since Prop 215, I think in 1995, 1996, people have a different view about it. But let's not forget the issue with it. In the 70s and 80s, the THC level was probably 5 or 6%. Now marijuana that you find that our young people can get, and they will tell you this, they can get marijuana easier than alcohol, it's at about 22, 25% THC level. Highly addictive. So the nexus of alcohol, marijuana, and prescription drugs. Now we get into prescription drugs, and the problem gets larger. And it impacts all of us because when we saw the spike of the substance abuse in 2010, we saw a significant spike in burglaries. People were entering people's homes and they're stealing jewelry, iPhones, iPads, and they're going into the medicine cabinet. They're using parents' credit card to order Vicodin, Oxys, whatever they can online and getting it delivered to their home. You saw that dynamic. It became too expensive. So what did they start using? Heroin. In Thousand Oaks, as John mentioned, about $20. So it became a cheap drug. And the view of the community, oh, heroin in Thousand Oaks? It can't be. That's in Detroit. That's in Los Angeles. I've seen that in the movies. That's not happening here. Well, it is happening, and that's one of our greatest challenges: the education of the parents. We hosted the forums. Now, with this, we don't have a panel of 10 cops. We have a doctor from Los Robles Hospital to talk to parents and their kids about the medical side of it. We have law enforcement on the panel, of course, but we have the schools, we have counselors, and we have impact statements from parents who've lost a loved one. And then in the back, and we've had anywhere from 100 to 400 people at these forums. In the back, we have vendors, probably 10 to 15 different vendors, rehabilitation, all counseling, all different types of help for these kids and the family. So they can go out and mingle, because in these forums, they're not going to raise their hand and say, my son or my daughter has a problem. They'll go back and talk one-on-one, so that's been very effective. I'm going to have Jim talk about, and Eric talk about the Parent Project and some of our prevention efforts, because that's huge. There is a balance. I mentioned earlier we can't arrest our way out of it, but make no mistake about it, our enforcement is critical. Getting these people that are going after our youth and getting them addicted is critical. But educating the parents and having kids make the right choices is just as important. Jim?
Yeah, much like you in Santa Clarita and in Simi Valley, we have a great relationship with our school district. Last year, the commander and I and Eric were invited to the school district to present at back to school nights. And we just said, we need 20 or 30 minutes to talk to your children about choices they make. What we know is that 99.9% of kids are good kids, but they're all one choice away from a disaster. So we wanted to highlight that, not just a one-time deal with every 15 minutes where it builds up at the end of the year, but using the crash car trailer and it's easier to bring out, it's not as disruptive to the school, and we can start that dialogue with the kids more often. But also it's a chance at these back to school nights to talk to the parents that are not aware what the problem is. They're there signing and picking up their 15 forms, and then they're going to hear us talk for 20 or 25 minutes. And we made ourselves available afterwards because, like the commander said, they're not going to raise their hand in an audience full of 2,000 people and say, hey, my child has a problem with their child sitting there. They come to us afterwards and say, hey, where can we reach out for help? What can we do to help? And we really were able to answer a lot of questions for them in the high school level. And then working with the district advisory committees, we invited all the schools, middle, elementary school, their parents and students to come and talk. The school district opened their doors, and we held the meetings there. Some meetings we had as many as 60 or 70 parents show up. Some meetings we had as few as 10. And I start the dialogue with saying, maybe our advertisement is flawed. What if I told you by coming to this meeting, I'm going to give you the answer of how you can reduce your child's likelihood of using drugs by 50%? How many people want to hear that statement? Well, they all raise their hand. Well, talk to your kids about drugs. Talking to your kids about drugs is going to reduce their likelihood of even using it by 50%. And so we start our premise, that dialogue with them then, just letting them know, your kids are good kids. They have a very unique environment they're growing up with. Their access to information is unprecedented. And trying to get into them and get them that information of how harmful these substances are and where it starts. We've talked about this transition of, alcohol, marijuana, prescription pills, and heroin. Not every kid that tries alcohol is going to become a heroin addict, but every heroin addict started with something else. They didn't just jump right into heroin. So it's really important to address those risky and at-risk behaviors earlier on, and we do that through Parent Project, which I know Eric will talk about at length, but we've been offering Parent Project much like Simi for years. And in some years, it's harder to get parents engaged than others, to get them involved, to get them to show up. Some of them show up the first session and get the book and figure that that's good enough. And we call them back and say, if it was easy as getting a book, you'd have done that a long time ago. This is an opportunity for us to share with you some actual strategies on how to deal with your children that aren't listening, so that you can keep them from making those bad choices down the road. And so we found that, like we've said, all of us in this panel have said, we're not going to arrest our way out of this problem. This is a community effort. It's making people aware, understanding of what to look for, and then what to do about it. And you hit it on the head. When they're already stressed, they don't know where to look. Even if under their right mind, they could have found it with ease. When they're impacted by it, and it's their family member that's seeing this impact, they are at a loss, and they need help. They need to be directed on where to go to get that help. And that's what we all are now trying to do, is provide them that information, make it as easy as possible, and working with the nonprofits and our foundations and the behavioral health groups to let them know that this is not just a law enforcement issue. We're not here just to arrest us out of it. We need everybody's participation in this.
Just moving forward on some of the prevention issues or topics that we've tried to work with and implement within our city. A lot of similar things that have been done and have already been discussed. We talked about the community forums, but it was a full collaboration of working with the city, police department, behavioral health, school district, park district, fire agencies, healthcare, public and private treatment, and bringing everybody in, as the chief explained, and giving as much of a comprehensive type of overview of what the issues are and what the problem is within the community. But being a part of those forums and talking with individuals and talking with kids that have been affected by this, and maybe they're recovering, when we're looking at it, and you mentioned the demographics of the 18 to 25-year-olds, what we've found is that the kids are using these prescription drugs during high school, but they're able, and because they know mom and dad are kind of monitoring and seeing things, they keep it under control. Although they're still using, they're still addicted to it. And as long as they're getting good grades, I've heard a lot of straight A students and above that were addicted through high school, but then once they were off to college and on their own, and then the behavior and the problem got out of control, and that's where we're seeing those overdoses and deaths in that age group afterwards. So looking at it and trying to hit more of a target audience and try to bring those in, we put the forums out, we put the information out, we've advertised our parent project as well, but now even working with some of those same collaborators that we had on the forums, we changed this year to the teen reality parties, and still had a breakout group afterwards as it's set up, but to talk to the parents and try to educate the parents about what is going on. And it's not just with prescription drugs, it's not just with harder drugs, heroin, but it could start with marijuana, it could start with alcohol. It's those risky behaviors that as a young person they're getting involved with. They're starting to show maybe a likelihood of taking some type of risky behavior. So can that progress as they grow up? And to make parents aware of that and to deal with it at a lower level before it gets out of control. And bringing some of those same counseling units available, again, both public and private, bringing them in and starting to get treatment. And that's where the school district also looked at this program, the Breakthrough Program, which I think they took a model out of Rancho Murrieta, the program that they had, and they got a grant for it. And like I said, any type of hurdle to any type of education thing, it's more of an intervention program for the students now versus the suspensions. And getting kind of removed from that element is to try to get them some type of intervention, get them some type of help, and then also bring the parents into that program as well, get them some education, and kind of hit it on the forefront of what is happening and what's going on and what's the core or the root problem leading up to some of the things that we're seeing that's making more of the headline news. And again, working through those or working with those school district and some of the other counseling programs and stuff, we're able to get more of a target audience for our parent project. As John mentioned, it's a 10-week project or a 10-week program where the parents come in and they get skills to deal with behavior, whether it's not following rules, there's drug use that's talked about, there's gangs, so each week is kind of a different topic within the program itself. And then in conjunction with that, the chief mentioned the Fulcrum program. We have SROs in the Conejo Valley as well. They oversee the high schools and then also filter down into the middle schools, the feeder schools, into their high schools to deal with that. But we were looking and maybe we're still missing that young population, so we brought the Fulcrum program into it. But part of that program is also teaching kids conflict resolution. So if we can start teaching them at a younger age, a 5th and 6th grade level, give them some of those life skills that maybe they were just missing early on, and as they go through life, whether it's making choices of, do I go over to this friend's house? Is that a good behavior? Is it not a good behavior? If I get offered drugs, they now have more confidence in their own abilities to say no and to make those right decisions. So that's what we're looking at, more of a comprehensive program.